I'd like to call the Nash County Board of Commissioners meeting to order for July the 8th at 9:30. It was a recessed meeting from Monday. And as we all know, each one of our meetings, we begin with a prayer by a sitting commissioner. And during this time, you're welcome to stand and join us in the prayer, or you're welcome to use this time to have your own prayer, or you're certainly welcome to use it for a moment of silence, whichever you desire. And after the prayer, Commissioner Wayne Outlaw will lead us in the Pledge of Allegiance. At this time, I'd like to call on Commissioner Lou Richardson for our invocation.
May we stand, please? Unto God of grace and of mercies, we thank you for this day, for what you have done and what you are yet doing for us in our lives. We thank you for the blessings of life, health, and strength. We ask for a special blessing on all our people suffering from this virus and other issues that is besetting them at this time. We ask for your protection and guidance through all that we say and through this day and throughout life. It's in your name we ask this all. Amen.
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 Amen. Would you join us in the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I posted it to the website.
Are you complete with that part, Mr. Edwards? Yes. Okay. We're now on item number 4 on our agenda, and really the only item on the agenda, unless the commissioner or the manager has something else they wish to bring up, and it is a resolution. And I'll call on our Public Health Director, Dr. Bill Hill, to make this presentation. Good morning, sir.
Good morning, Mr. Chairman, Commissioners, County Manager, distinguished colleagues. Hope all of you are doing well this morning. I will preface this resolution by just reiterating the number of cases we've had over the weekend: 15 Friday, 9 new ones on Saturday, 5 new ones on Sunday, 10 on Monday, and 21 yesterday that you don't know about, of which 11 were from the Hispanic community. So this I do come to you today with a concern with the spread. A lot of it's community spread, as you know, person to person. I have before me, and one that you've received and had a chance to review prior to this meeting, a resolution, and it's fairly lengthy, but fairly comprehensive in its context, and I'll now read it and ask for your approval or adoption of this resolution. This resolution recommending adherence to the Centers for Disease Control and Prevention guidelines to prevent the spread of COVID-19, otherwise known as coronavirus. Whereas the North Carolina General Assembly has adopted Article 1A of Chapter 166A of the General Statutes entitled, quote, North Carolina Emergency Management Act, end of quote, which sets forth the authority and responsibility of the governor, state agencies, local governments in prevention of, preparation for, response to, and recovery from natural or man-made emergencies. And whereas General Statutes 166A-99.22 and General Statutes 166A-19.31, which are part of the North Carolina Emergency Act, authorizes counties and municipalities to declare states of emergency and authorizes counties, municipalities to impose prohibitions and restrictions under conditions and following procedures contained in said general statutes. which I'll repeat, General Statutes 166A-99.22 and General Statute 166A 19.31. And whereas the novel coronavirus is a global pandemic that is easily transmitted from person to person and has created a state of emergency in the state of North Carolina and the county of Nash. And whereas Nash County signed the proclamation of state of emergency on March 16th, 2020, and whereas the Centers for Disease Control and Prevention, otherwise known as CDC, has determined that COVID-19 is spread primarily between people, close proximity to one another, and can be transmitted through respiratory droplets produced when an infected person coughs, sneezes, talks, and recommends social distancing to prevent the continued spread of the virus. And whereas the slowing and controlling community spread is critical to ensure healthcare facilities can meet the demands of those needing healthcare and not overwhelm the system, and whereas CDC recommends wearing a face covering or non-surgical protective face mask in public settings, practicing social distancing, and washing one's hands frequently as measures designed to help slow and prevent the spread of the virus and to prevent individuals who may be infected and unaware from transmitting the virus to others. And whereas the number of laboratory confirmed positive cases in the state and in Nash County continue to climb, as do the number of deaths related to the virus, but social distancing continues to decline. And whereas on June 26, 2020, William Hill, Nash County Health Director, made a plea to county residents to continue to wear masks, wash their hands often, and wait at least 6 feet from others. And whereas, in consideration of all the current available data related to the impact of COVID-19 in Nash County, the Board of County Commissioners has determined that due to the recent trends, it is in the best interest of the residents of Nash County to issue this resolution recommending the following conditions to slow the spread of COVID-19. Now, therefore, be it resolved that this resolution is being created to recommend and encourage all Nash County residents, as well as visitors to the county, to maintain the recommended social distance, practice proper hand washing procedures, and or hand sanitizers frequently, using both methods in that area, especially after contacting commonly touched surfaces, and wear some type of face mask or face covering or protective face mask when in public places, indoor and outdoors. This, the 8th day of July, 2020, by Mr. Robbie B. Davis, Chairman, Nash County Board of Commissioners, attested by Mrs. Janice Evans, Clerk to the Board.
Thank you, Mr. Hill.
Thank you.
At this time, I'd entertain a motion for this board to adopt this resolution.
So moved.
Second.
I have a motion by Commissioner Outlaw. I have a second by Commissioner Wells. Is there any discussion on this motion prior to taking a vote? Mr. Outlaw, you brought this idea to us, and of course, it was all about the number of calls that commissioners were getting about continuing to see our citizens not do what our health director was asking us to do. Would you like to make any further comments, Mr. Outlaw?
I would briefly say that I have received calls, people indicating they were concerned about their parents. Most of these calls were from younger individuals. They were concerned about their parents. I appreciate that concern. Myself, my family personally, we have a grandson that's 18 now, but he had a kidney transplant when he was 2. So welcome to our world, because we've always practiced these things in trying to keep Baden safe and healthy. So I encourage anyone, we cannot mandate that you wear a mask or follow these procedures, but we would certainly encourage and recommend that everyone wear a mask, wash your hands, sanitize as possible, and try to keep some reasonable distance from people. Thank you, Mr. Chairman.
Other commissioners like to comment? Mr. Belfield?
I like particularly this fifth whereas, there where it talks about coughing, sneezing, and talking in close proximity. That's something that people really need to place emphasis on. And forget about this situation. Now, I've heard these comments trying to violate my individual rights that tell me I got to wear a mask. And they ought to just think about in areas where this was widespread on that individual right, now that the virus has attacked a number of people and hospitalizations going up. And I would hope that the public would understand that regardless of age, even small children are catching this and have passed as a result of it. So I just pray and hope that our citizens, especially here in Nassau County, but all over the United States, will realize that in order to bring this under control, we're going to have to do these practices, do the 3 W's. And that's my take.
Thank you, Commissioner Belfield. Other comment from commissioners?
Yes, Mr. Chairman, I would just like to say I'm proud to see all of us wearing our masks today, and I think that's our priority, is to lead by setting example. So we can't ask other people to do what we're not doing. So when we show that we're doing what we are asking all of those to do, to remind them it's for all our safety, thank you for standing up and showing that we are leading by example.
Thank you, Commissioner Richardson.
I would just like to comment on you and the health department and the great job you're doing to keep us informed. Because I've talked to some people in some other counties, they don't know what's going on. I can say one thing for Nash County, we know what's going on, and I think it's because of you. Thank you and your staff.
Well, thank you so much for that comment that I really don't deserve totally. It really starts at the county management level. We, from day one, just about were extremely transparent and tried our best. Even the commissioners very much promoted this very transparent sort of news media outlet transmission of news that we were providing. So it's something that I think has behooved us in many ways to help us move in a positive direction and keep our citizens cognizant of what's going on. I hope that has added a precautionary note. When we say we've got 21 new cases today, or we've got 21 people in the hospital, I hope that makes us all aware that we still got this virus around. You can't see it. It's very small, probably 100 times smaller than bacteria. Bacteria you can't see. If you would take a light coming through a window and seeing the lint sometimes just float, that's a similar pattern that you can see from droplets. It stays in the air quite a while. Thank you. Thank you for those comments.
Mr. Leggett, I know you bound to have some concern about the Hispanic community in the occupation you're in. Anything you would like to add as it relates to that? Because that just seems to keep climbing, as evident today, 11 out of 21 cases.
Right. And again, thank you, Mr. Hill, for your diligent work on this issue we've had and your outreach to the Hispanic community within your department, and then the other clinics and things that reach the Hispanic community. I've seen that work firsthand that they've been doing, And they are out there and touching these residents and assisting these residents. So I want to thank you there and just encourage the public to do the right thing in this situation. These are just unprecedented times, and some people compare this to the flu, but I wouldn't necessarily liken it to the flu. It's really important to do the right thing when you're in public and in even some small gatherings.
And I know that you have been proactive. We've had these conferences starting back probably in March or April, what to do when our farm workers come to Nash County, and some of those things have really, really helped, and we appreciate that, because you have an environment obviously conducive to the spread when you have people working close together. You have a positive working for you outdoors, and they can space themselves somewhat often. But I appreciate what you've done. It was not just your farming interests, but your fellow large farmers that you've communicated with.
To the citizens of Nash County, you can see that this board is very concerned about the citizens of Nash County as it relates to the COVID-19. As we move around, and I indeed, like Commissioner Outlaw and all of us, have had numerous calls from people probably on both sides of this equation, some thinking we shouldn't overstep our bounds, but certainly many that are concerned about their older parents, concerned about the kids not being in school. That is a key concern that I have personally. Not that I have kids in school, but I do watch my grandkids and the kids in the neighborhood, and I've made it a point every time I see a person that's in K through 12 now, I ask them, are they ready to go back to school? I used to get a varied answer on that. They're all ready to go back to school now. I hadn't found one that wasn't ready. But the only way we're going to see clear to put our kids back in school the way they were is we got to continue to follow what we've heard this morning from our health director. Used to, a few weeks ago, if you were out in public without a mask, you may not have been in the minority, but I can tell you now, most people are following it. But you still see quite a few that for some reason just have chose not to do that, and it's generally along the lines of what Commissioner Outlaw said. They're afraid someone is infringing on their rights. But when you're not following the directions of a very educated and competent health director in your own county, which he has pleaded with us this morning again to do this, I think you're just not doing the wise thing. So we continue to ask you to follow the only three things that really you got to remember. They're pretty simple. So at this time, with that said, I have a motion on the floor. I have a second. If there's no other discussion, all in favor of adopting this resolution, let it be known by saying aye. Aye. Any opposed by a like sign? The resolution stands adopted unanimously. Dr. Hill, and thank you for bringing it to us this morning.
Thank you so much for your support.
Yes, sir.
Take care.
Thank you for your
Mr.
work,
Chairman.
Dr. Hill.
Commissioner Outlaw?
No, I just want to thank
Okay.
Bill for the work that he does and his staff.
Yeah. Yeah, I think you're doing a wonderful job. And, Mr. Chairman.
Yes,
I
sir.
have a question that maybe I need to ask the county manager. There's possible some people, low income, homeless, whether that may not be able to get a mask without someone giving them one. Is it possible that we as a county can give out masks through some grant that we receive?
I'm sure we could. I know we offer them to people coming into this building that don't
Yeah, I
have them.
understand that, and some of them refuse it.
But, and I do believe there may be some groups out there that are doing testing that provide masks. But I would want to get with the health director and Mr. Fisher with emergency management and see if we can get a good supply of masks and make them available. But yeah, I mean, we've got enough masks that if anybody needs one, we can certainly provide a mask to every citizen, or we will, if that's what it takes. Most people have gone out and gotten a mask, but anyone that doesn't have one, we can provide them a mask, I feel certain.
Well, it's important to remember, too, if you don't have a mask, you can still cover your face with some type covering. I was in Wilson this week, went over to a place, Bestenberger's, actually. It's a great place if you've ever been over there. And I sat outside, and they brought food out, and I saw a gentleman coming up with no mask on, but he took his T-shirt and pulled it up over his face. So he covered his face, which is what you want people to do. To protect yourself and protect others. So, you know, if you don't have a mask, there are ways you can still cover your face.
Mr. Chairman, if I may, I just would like to thank the board for showing your concern on this issue. Along with the health director, I've been on a Wear Your Mask campaign myself over the last few weeks. And the fact that y'all would have a special meeting and pass this resolution shows that y'all care about the citizens of this county. And I thank you for your support of the health director and his initiative, and the state's initiative, and the federal government CDC's initiative to encourage the public to wear masks. Thank you.
Thank you, Mr. Lamb. Last comment, while Dr. Hill's in our presence, I will say, I do get concerned about our health director from time to time, because I know he stays up and stays on this all the time. Usually a couple times a week, I'll call him late, ask him to go on home. But I feel a little better today. I got a report yesterday that he does sleep some. In fact, Saturday night, I was told he went to bed at 3 o'clock in the morning, but he slept to 2 o'clock on Sunday afternoon. I'm not sure whether it's true, but I am glad that you are getting rest, sir. It makes me feel a little bit better.
I'm not sure every bit of that. I think maybe part of that to 3 o'clock might have been a nap after lunch, but it gets close.
Okay. I do know you got up at 2 o'clock on Sunday anyway. Anyone else, any board member have anything else to bring before the board this morning? I appreciate all of us being here. I did not say that Commissioner Combs is out again this morning, and I'm not, it's health related. He is doing fine presently, but he chose not to be with us this morning. I fully understand that. Mr. Belfield, do you have another comment?
I was just going to say, I know this is going out to the news media and everything.
Yes, sir.
What's the possibility of giving copies to community organizations, and maybe they can share it with group, even churches could share it, even though they're not having church service in the church, but they are running services so people can hear it through Zoom and Facebook and telephone.
Right.
So,
First of all, we can certainly send it to our sunshine list. Everyone that's asked to get notice of all our meetings, Mr. Edwards can certainly put it on our Facebook page, and we as individuals can put it on our Facebook page. If there's a contact to get it out to all the churches, if you'll give that to Janice, then we will try to distribute it as far and as wide as we possibly can.
okay.
All right. Any other business before the board this morning? Not, I'd entertain a motion for adjournment.
Move adjourn.
I have a motion by Commissioner Belfield, second by Commissioner Wells. Any questions on that motion? Mr. Lamb, you don't see a need for us to recess this meeting?
No, if something comes up, we can do a 48-hour special meeting.
And this would be the only meeting we would have in July.
That's correct.
Okay, all right. All in favor of the motion for adjournment, let it be known by saying aye.
Aye.
Any opposed by a like sign. Board stands adjourned.